Hello everybody, it's Adam, the geneticist from Verdure Healthcare. So today let's continue with our part 2 talk in 13 chromosome. And today I would like to specifically focus on the Patau Syndrome because this is one of the more common ones that we see in Asia. Alright, so last time we have talked about chromosome 13, part 1, which is other diseases. So chromosome 13 is located over here, whereby, let's give you a bit of a refresher. So remember that each of us is made out of cells, and within the cell, there is the command center called the nucleus. Within that, there is the chromosome. So chromosome is actually made out of DNA, and within the DNA, you'll be able to see the genes. So this is the sequential order. Right, so just one more fresh reminder before we move to the main topic. We have two kinds of genetic diseases. So single gene disorder and chromosomal abnormality. Now, chromosomal abnormality means that there is something wrong with the entire chromosome, whereby there can be an extra piece of chromosome, one piece less, a duplicated section of the chromosome, or a deleted section of the chromosome. So this is at a bigger picture level. So single gene disorder means that when you focus onto the DNA in a very small scale, whereby you can see the DNA code individually. So there are diseases such as the one we have talked about in previous sections, whereby you only need to have one or few pieces of the DNA missing, duplicated, or substituted by other DNA that shouldn't be there. It is already enough to cause you a majority of problems. And of course, that includes genetic diseases. Okay, so since chromosome 13 is a major chromosome, the ones that we have included over here, the diseases that we talked about, includes the autosomal recessive neurosensory deafness that we talked about last time. We've also talked about the breast cancer or the BRCA2 gene. So if you are interested, please by all means go back to the part 1 that we've just done the talk on. And Patau Syndrome, which is what we're going to talk about today. And then in the next part, in part 3, we're going to talk about the retinoblastoma, which is one kind of an eye cancer, Wilson's disease, young man's syndrome, and these are all horrible diseases that we need to prevent. Okay, so let's move on with our main topic, chromosome 13 Patau Syndrome. So what exactly is a Patau Syndrome? So this is a chromosomal condition, okay? Remember there are two kinds of genetic disease. Patau Syndrome is at the chromosomal level, whereby it is associated with severe intellectual disability and also physical abnormalities in many parts of the body, okay? Alright, so individuals with chromosome 13 disorder usually have heart defects, okay? Brain or spinal cord abnormalities, very small or poorly developed eyes, extra fingers or toes, an opening of the lip, which is the cleft lip, with or without an opening in the roof of the mouth, which is called the palate, and weak muscle tone. So kids with Patau Syndrome, they will not be able to sit or stand properly. Okay, now because of these severe disorders and defects, many of these poor chromosome 13 babies, they will either die in the first day or the first week of their life, all right? So according to many researchers across many countries, only 5 to 10% of these kids will make it past the first year. All right, and the reason why we need to prevent this is because when parents see such a defect in their baby, it will cause a lot of psychological harm. And sometimes they might even get infertility after giving birth to a Patau Syndrome babies. At Verdure Healthcare, we have seen these, okay? So many people will ask me, Adam, these are all horrible diseases, horrible symptoms. Is there any way to treat it? Okay, so honestly speaking, treating a genetic disease nowadays is more like a fantasy rather than a factual science. But there are certain pathways that we can theoretically deal with it. So one way would be the mutated gene. We deal with it directly via a transplantational genetic therapy, okay? Which means that, okay, we find that this piece of DNA is wrong, is duplicated unnecessarily, we cut it out using a pair of scissors. Some of you might have heard of the genetic scissor, it's called the CRISPR. So we cut that out, but obviously that is an experimental kind of a treatment. Mutant protein, okay, because DNA produces protein, we can try to treat it at this level, so it's getting more superficial. Metabolic misfunctions, okay, so this is definitely not one of the treatments for Patau syndrome because it isn't just metabolic functions that's going on wrong, all right? Organ malfunction or clinical problems using surgical intervention. So for example, if let's say there are some kind of genetic disease that only affects the heart, such as the familial dilated cardiomyopathy that we talked about last time, we can do a heart transplant, we can do liver transplant as well for those. So currently, in fact, surgical intervention is the most practical kind of solution to a genetic problem, all right? But why not prevent this from happening? So how do we prevent this? It is via genetic testing. Okay, so at Verdure Healthcare, we have something called the non-invasive prenatal test. In fact, thanks for everyone's support, in 2013, we have just won the Baby Talk Mama Papa magazine Reader's Choice Award for our NIPT and genetic counseling service. It's a gold award, so I would love to take this opportunity to thank you everyone for your kind support in nominating us. Okay, so some parents, they might be a little bit reluctant to face a genetic test, and they might say, Adam, what are the opportunities or what are the odds of having a genetically mutated baby? Well, let's have a look at this fact here published by the UN Specialist Center. They're saying that yearly around 16,500 of Malaysia's 550,000 babies are afflicted with congenital abnormalities, and about 1/3 may succumb to these illnesses before reaching their first birthday. So it means that, okay, yearly we have this many babies being born, okay, more than 500,000, but about 1 in 30 babies will get some kind of a genetic disease or congenital abnormality. I mean, this statistic is horrible, so we need to work hard and prevent it from happening. So, as you might have heard me say before, especially in the other NIPT talks, that these diseases like Patau syndrome, Down syndrome, Edwards syndrome, they are not inherited from the parents, okay? Even if it is inherited, they might not inherit the full thing. I'll explain a bit in detail later on. But anyway, most likely, these diseases are sudden mutations. How does that even happen? Okay, when mother and the father each contribute only 50% of their genes to the baby, then this baby would be extremely healthy. There is no genetic kind of mutation, at least at the chromosomal level. But if either the mother or the father's gametes, meaning the sperm or the egg, has an extra piece of chromosome in there due to a duplication defect, all right? So meaning to say when the eggs get matured and then suddenly there is a replication error, meaning to say that there is an extra piece of chromosome in the egg, then it might cause a problem for the baby. All right, same goes for males as well. But because mothers, they do not produce new eggs after they are born. So the eggs, they will follow the lady's age, and as they age, the likelihood of getting a defective egg is actually higher. All right, so this is the Patau Syndrome chromosomal lineup over here. So with the Verdure Healthcare's non-invasive prenatal test, NIPT, we will be able to detect this. All right, it's a very deep technique whereby we line up all the chromosome here, and we will be able to see if there is an extra piece of chromosome in the 13th slot. All right, and so this is the Edwards syndrome, where you can see on the 18th slot there is an extra piece of chromosome, and then Down syndrome on the 21st slot, there is an extra piece of chromosome there. Okay, so let's have a look at the odds. This is the risk, okay, the straight line here, and this vertical line over here is the maternal age. And as you can see for both lines, after the maternal age of 35, 36, it goes up significantly. All right. If we compare to this extreme here, 20th, 21st, 21 years old, all the way up to 30 years old, of course this is maternal age, and then there isn't a significant risk at all. All right. So if we look at the age of 49 within this group, if we were to look at this red line over here, which represents all the 3 diseases added together, 1 in 8 baby will get either Down syndrome, Patel, or Edwards syndrome. All right, if it's just Down syndrome, okay, every 1 in 11 baby will be getting it. Okay, so one of the significant features of the NIPT is to be able to tell the age. So as we can line up all the chromosomes, if we do see that there are 2 X chromosomes, it will be a baby girl. If we see an X chromosome and a Y chromosome, then this will be a baby boy. And that's how we tell the gender of your baby. All right, so with the NIPT, we don't just detect Down syndrome or Edwards syndrome or Patel. We also detect these rare sex chromosome abnormalities. So for example, suppose a boy should have an X and a Y chromosome, but now he has an extra piece of an X chromosome. This is called Kleinfeldt syndrome, whereby he might have sexual immaturity, meaning to say he cannot produce the sperm cells. He might get more female features such as breast swelling or more female hormones. And giving a girl example, if let's say this girl has an has 1 X chromosome missing, which means that she only has 1 X chromosome, then this is called the Turner syndrome. Now this girl is going to have a very short stature, webbed neck, and sexually undeveloped. Okay, furthermore, if we were to zoom in, so once again, sorry for my long-windedness, there are 2 kinds of genetic diseases. One is chromosomal and the other one is the single gene disorder, right? So now, all that we have explored is actually the chromosomal level. But now, we need to zoom in and look at what's in the chromosome, which is the DNA and the genes. And now we have collected 84 Asia's most common genetic diseases, which are called microdeletions, whereby it only affects a very small amount compared to the chromosome, but it is enough to cause the disease. There are some diseases called Wilson's syndrome, Angelman syndrome, and etc., which we will go through in future talks. Okay, so how does the NIPT work? Okay, the moment you're pregnant, all right, you will have a connection with the baby. So as the baby grows in your tummy, all right, the placenta and the umbilical cord will start to come into effect, whereby you, as the mother, when you eat the food, all the nutrition will be passed on via this channel. And in the same way, the baby will give you back the waste product for you to actually deal with it. So under this exchange method, in your bloodstream, we will be able to find pieces of DNA that the baby has left in it. All right, so only we need to take 10 milliliters of the mother's blood, we will be able to find about 5 to 10% of the baby's DNA in there, in that sample, and we will be able to run the genetic test for your baby. So compared to the old technologies called the amniocentesis, whereby this NIPT is a non-invasive technique whereby we don't have to stick a needle into the mommy's tummy. So as you can see, this is quite a high-risk movement whereby when we take the amniotic fluid, the doctor has to use the ultrasound equipment to scan the tummy and to find a space like this so that he can poke a needle in so that he can extract the amniotic fluid, which is still quite a number of risks because the baby can move anytime. Alright, but the thing is that most importantly, you need to find a qualified person in order to help you do this NIPT test. There are a lot of genetic tests in the market, but they are not the same. There are some that are more for your health, okay? But there are some clinical genetic tests which are definitely more serious. So things like NIPT is definitely a clinical genetic test. So in order to be qualified to do this, the medical personnel has to have, of course, a proper certification. So for myself, for example, I have a postgraduate certificate in surgery from the Royal College of Surgeons of England. So I'm originally qualified as a surgical instructor, but I no longer teach surgery. In fact, what I do is I focus on genetics. But we need extra qualifications in order to do genetic tests for you. So I'm certified by Stanford University in their genetics and genomics. So I'm certified this way, and also by Harvard Medical School with their genetic testing and sequencing technology. Furthermore, I'm also certified by Johns Hopkins University with genomic data science. So with my base in surgery and all these qualifications from top US colleges, only then we are able to help you do the genetic test with proper report analysis. Okay, so just one final thing before we conclude this session, whereby commercial DNA tests, like I briefly mentioned just now, how do they work? Okay, so as I mentioned before as well, that they are more for your health, okay, whereby all you need to do is just to go to the online shop, order one of the test package, they will send a kit to you. All you need to do is just to follow the instruction to collect your saliva sample and send it back to wherever the address that they asked you to send. So these tests, they are more for your health, so such as what food should you eat, what kind of exercise you need to do. Some genetic tests even tell you about your personality and which career pathway you should go through. But we need more science data in order to back those up. But whereas clinical genetic tests such as our Verdure Healthcare's pre-pregnancy DNA screening, reproducing infertility test, cancer genetic screening, and this NIPT test, they are all clinical. So what's the difference between clinical and non-clinical then? So all you need to remember is that for clinical genetic tests, you cannot tolerate any error at all, okay? Because any medical solution or treatment will be based on this particular test, okay? Whereas for commercial DNA tests, if you're suitable to eat orange, but the test result says that you're suitable to eat apples, but I guess that wouldn't do much of an effect, but that doesn't really apply in clinical genetic tests. It has to be 99.9% accurate. All right, so of course, in this case, one last reminder is that we encourage everyone to enhance your sperms and egg cells before you get pregnant, because after all these kinds of horrible genetic diseases, they are created by spontaneous genetic mutation, which are not inherited, whereas it is due to a defect in the sperm and the egg cells. And with that, our products has also won the Reader's Choice Award 2021 with our VHC formula female 1 and 2, male, VHC formula male, and our VHC confinement 1 and 2 has also won this award, thanks to everyone's support. And very gladly, I'm proud to announce that Verdure Healthcare, we have won the Super Brand Awards. We have gotten the status in 2021 and also 2022. Further information will be released in a later date. Alright, with that, we have already come to the conclusion of our session in part 2 of our chromosome 13 talk. In the next talk, we will continue with part 3 for the rest of the 3 diseases. Thank you very much, everybody. Have a great day ahead.